All right, good morning, everybody. I'm going to go ahead and get started. So my name is Holly Woods, and I'm the Director of HR over the Benefits, Compensation, and Wellness areas. I've been with Cuyahoga County now for almost 6 months. So spent the last 6 months just kind of diving into the benefits, the compensation, wellness. We are going to have a new wellness program, as you've probably heard in different forums, looking at introducing a wellness program at the beginning of 2017. So a lot of exciting changes that are going to be coming. Very fortunate to have this opportunity to come out and talk to you about what to expect for open enrollment. I'm sure you've seen a lot of information and you may have a lot of questions on what it is that you need to do in order to be prepared for open enrollment. So wanted to provide this opportunity to go over and provide an overview for you of what to expect. So I'm going to go through the presentation. If you have any questions throughout the presentation, please feel free to ask. I will ask if you raise your hand, we'll get a microphone so those individuals that are watching on the live stream can hear your questions through the microphone. We will have some open question and answers at the end of the session as well. Okay, so I'll get started. All right, so I'm going to talk about what you should know during open enrollment. I want to give an overview of the process, the goals of the open enrollment process, and we really want to talk about the benefit educator piece. As again, as you may have heard or you've seen, you need to meet with a benefit educator in order to get enrolled in your benefits for 2017. So I'm going to talk about how to get scheduled for that meeting and what that process should look like. Also want to talk about who's eligible for benefits and what those benefits are. We're also going to talk about a dependent eligibility verification. Essentially, it's a dependent audit. If any of you have any dependents, a spouse or a child on your medical plans, you're going to need to participate in a dependent eligibility verification. And I'll go over what those steps look like as well. We'll also be giving a medical insurance overview. I'm not going to go into detail about rates, copays, deductibles, or plans, but I will show you online where you can review that information on your own. I'll also talk to you about how to get scheduled for your benefits enrollment meetings. If you haven't gotten scheduled yet, you do want to get scheduled because those appointments are getting booked quickly. And then we'll end up just recapping what it is that we need from all of you to make sure that you have a smooth open enrollment process. So let me start with an overview of open enrollment. So open enrollment begins on Monday, October 24th. Hard to believe, October is almost over already. But Monday, October 24th, will actually start open enrollment, and it will end on Friday, November 11th. So Friday, November 11th is a holiday. Many of our agencies are closed on that day. However, we will have phone support available. So if you need to make any last minute adjustments, or if you've waited to the last minute, you will have the availability on the 11th to call in and make any final adjustments. Now, all employees are required to participate in an active enrollment this year. So let me talk about what an active enrollment is. All employees, again, are going to be required to meet with a benefit educator in order to get enrolled in their benefits for 2017. Benefit educators will be available one of two ways. You can meet with a benefit educator face-to-face on site. They'll be coming out to different agencies during work hours, during specified dates and times. They're going to be coming out to a number of our agencies, so if you're an employee that travels to different locations, you can identify the location that's most convenient for you and you can schedule at that location. Your secondary option to meet with a benefit educator is to do so by the phone. Now, I'll say the phone experience should be just as good as the face-to-face experience. So if you're concerned about not having a face-to-face meeting, you should get the same type of process on the phone as you would in person. Of course, you're just not sitting with that individual, but they'll have all the information to review with you, and they'll be able to enroll you by your phone conversation. So why do you need to meet with a benefit educator? First and foremost, they're going to handle your enrollment for your 2017 benefits. That's why you need to meet with them. They're actually going to do the enrollment. You're not going to be able to go into the system and enroll yourself in those benefits. So again, why are we going to have them there? Just as their name suggests, they're benefit educators. The county has a lot of great benefit programs. It can be very overwhelming to understand all the benefits that you guys have available to you. As a new employee myself, there was a lot to go through and a lot to try and understand. It can be very overwhelming. Medical care benefits, they can be very complicated at times. So we wanted to bring in a benefit educator to truly go through the plans, help you understand the differences between the programs, help you understand what might be the best program for you and your family based on your medical needs. And then in addition, they're also going to go into some voluntary benefit plans as well, things like your short-term disability, voluntary coverage, life insurance as well. Now, these meetings, you're scheduled for 25 minutes. You can use as little or as much of that time as you need. You could be done as quick as 5 minutes if you just have a few questions and you want to get enrolled. But if you really want to dive into the benefit packages, you can take up to 25 minutes in total. So again, the flexibility is there that you can sit down, enroll, and be on with your day, or you can take some time and truly go through the benefit information. In addition to reviewing the benefits, there's going to be a push on how to be a smart healthcare consumer. Unfortunately, healthcare costs continue to rise. It's our job to figure out how to get some controls in place to help offset that. One of the ways in 2017 will be to reintroduce that wellness program. If we focus on a culture of well-being and wellness, we'll help change that culture and help drive down costs, essentially. The other way is just to talk about how to use your healthcare plan. Simple things like, if you're not critically injured, do you know that it's better to go to an urgent care or a CVS pharmacy care versus an emergency room? And the reason for that is because it costs 3 to 4 times as much to go to an emergency room versus an urgent care. When the county's paying those costs, that directly impacts what you're paying in your rates. So it's all about utilization of the plans, and we want to make sure that we're teaching employees how to use the plans to the best of your abilities, so you're also helping us control those costs, which again, in the end will impact your rates. So as I mentioned, in addition to how to use the benefits and the differences of coverage, they're also going to talk about a new medical plan option. We have a new medical plan option under the Metro Healthcare Plan. It's a Metro Health high deductible HSA. And I'm going to go into what that plan looks like here in just a minute. In addition to the healthcare plans, they're also going to talk about a new voluntary benefits carrier. The voluntary benefits carrier is Trustmark. Trustmark offers our critical care, our short-term disability, voluntary life insurance, permanent life insurance plan. That's going to be the new carrier for 2017. Currently, employees participate in these benefits, these voluntary benefits, through Unum. Now, if you have these benefits currently through Unum, you do have the option to stay with Unum, so you're not going to be required to switch. However, Trustmark is a better plan. The rates are better. It's a richer program. Now, again, those benefit educators are going to be able to talk to you about the Trustmark plan, so you can make a decision if you want to stay with Unum or move to Trustmark. If you have a whole life insurance policy through Unum, a whole life insurance policy is one that you're vested in. As you pay your fees, you're building up equity in that plan. And if you have a whole life insurance plan, it's not going to be advantageous for you to switch over to Trustmark. If you just have things like the short-term disability insurance, the voluntary life insurance for a term policy, you will want to explore the Trustmark plan. It may be better for you, and you will experience no loss when you transfer to Trustmark. It's similar to having car insurance. If you decide you want to switch carriers, you pay a new rate. There's no loss to you. So again, they'll be able to review that with you, but you will have the option of staying with Unum or switching to Trustmark. Now, if you do decide to switch to Trustmark, then you'll be set up through payroll deductions from your pay to pay for the Trustmark benefits. If you remain with Unum, we will no longer be able to have those payroll deductions. Due to some system limitations, we do have to replace the Unum plan with Trustmark in our payroll system. So if you're going to remain with Unum, you will be set up on direct pay billing. Okay, so if you do stay with them, which you can, you'll be set up on direct pay billing, and we'll help facilitate that process for you. So let me talk about the open enrollment goals. As I mentioned, a big emphasis on education and truly educating our employees on all the plans that we have available. But also there's a secondary piece, which is a dependent eligibility verification process. And I'm going to go into that piece in more detail in another slide or two. But just to touch on it here, they are 2 separate processes. You're going to have your open enrollment process and then a separate process for the dependent eligibility verification. If you need any direction or you have any questions, your benefit educator will be able to address those. However, you're not handling that verification process through the benefit educator. And again, I'll go into more detail in just a minute. It's important that all employees meet with a benefit educator because, again, they're enrolling you or waiving your coverage for 2017. So, important point, even employees who are waiving coverage in 2017, you do need to meet with that benefit educator in order to waive your benefits. So again, just expressing everyone needs to meet with that benefit educator. As I mentioned before, they're not only reviewing the major medical plans, so if you're waiving, of course, you're not going to want the details on the medical plans, but they can talk to you about those voluntary benefits, flexible spending accounts, and other things as well. So everyone needs to meet with that benefit educator. Again, employees will be making benefit elections during their individual enrollment appointments. We have a very nice benefit website. We continue to add more and more documentation out there every day, so I encourage you to take some time and look at the benefits website. I'm going to pull it up here in just a minute and show you where you can find the rate charts and the benefit coverage summaries. But again, take some time, review those benefits so that when you meet with your benefit educator, you might be prepared with some questions because you've already reviewed that information ahead of time. This website, we do know that employees have experienced issues accessing it at some of our agencies using Internet Explorer. If you're having difficulties, just try accessing that using the Mozilla web browser or Google Chrome if you have that as well, okay? This website is accessible anywhere, so not only can you view it at work, you can view it at home, your spouse can view it. You don't have to log in, give an employee ID, it's accessible to everyone. Speaking of spouses, if you yourself do not want to handle your enrollment, you are welcome to have your spouse call in, schedule that appointment, and meet with the benefit educator to enroll you as well. So if you're someone who likes to involve your spouse in that process, they can even come to the meeting with you, or you can schedule your appointment by phone and they can handle that process as long as they have the required information to enroll you. So again, we want to make it very flexible. So let me take a minute and just talk about the benefit educator team. So Cuyahoga County will have a team of 23 dedicated benefit educators to help assist us during open enrollment. Over the course of open enrollment, we're going to be visiting 42 of our Cuyahoga County offices and facilities. Smaller offices with less than 10 employees will have to either schedule by phone or visit another agency to meet with a benefit educator. So again, we'll set that up through the management team, but agencies less than 10 will need to either schedule by phone or come to another facility to meet. And again, the phone conversation should be just as good as the face-to-face. You shouldn't experience any loss in customer service there. We're going to be educating or enrolling over 7,000 Cuyahoga County employees, but again, employees must schedule that appointment to meet with that benefit educator. You can do that online or by phone, and I'll show you where you can take care of that on the website. Key fact, employees who do not meet with a benefit educator, you will be defaulted into that Metro Health high deductible HSA plan. So again, it's important. Everyone needs to meet with that benefit educator. Otherwise, you're going to be defaulted into that Metro Select. It's a high deductible plan, not the current Premier plan. And there's going to be no appeal rights for employees who default into that plan. So again, it's very important that you meet even just to waive the benefits and to enroll. So let's talk about who is eligible for benefits. All employees working 30 hours or more per week are eligible to participate in the county benefit programs. Eligible employees may also enroll their legal spouse and or their dependent children. Now, for the open enrollment process, if you're enrolling your spouse or your child, you do need to have their social security number and their date of birth. You do not have to supply a copy of their social security card for the open enrollment piece, but you do have to have their socials and social security numbers and dates of birth. So again, when you're meeting with that benefit educator, you want to make sure you have those numbers, the dates of birth, so they can get them re-enrolled into your benefit plans. Anybody that was hired in 2016, you do have to meet with a benefit educator to enroll in your benefits for 17. And a nice change for employees, any employees' dependents are now eligible for medical, dental, and vision up to age 26. So some of our plans drop dependents off previously at age 23. See, somebody likes that. I see some of our plans dropped off previously at age 23. If your child was dropped off at age 23, you can use that open enrollment to re-enroll them. And again, they'll be eligible until age 26. Once they reach 26, they'll get a notification and we'll send them COBRA paperwork. So if you do have a dependent that can be added back on, you want to make sure you take steps to notify their current carrier that you're going to terminate benefits for them effective January 1st, because all benefits will be effective January 1st. So what benefits are going to be covered? We have our medical insurance plans, dental, vision, the basic life insurance plan. The majority of our employees are provided with a $6,000 Guardian life insurance plan through the county. That Guardian life insurance plan is still valid. There's no changes to the Guardian carrier. The remaining items, that's where Trustmark is going to come in. Our voluntary life insurance, our voluntary short-term disability, accident, critical illness, and permanent life insurance. Again, you'll be able to learn information about those plans through the benefit educator. We will be putting more information out there on the website so you can look at rates and different information on your own. But again, you'll also be able to get that from the educators. So let me talk about the dependent eligibility verification. Again, this applies to those of you who have dependents covered under your plan. If you have a child or children or a spouse on your plan, you will also have to participate in the dependent eligibility verification. If you do not have a child or a spouse on your plan, this part of the process will not apply to you. So we've partnered with an agency named HMS. It's an independent third-party vendor to perform a verification of dependent status as it relates to benefits. And what that means basically is we're auditing the dependents that are covered under our plans. Now, why are we doing this audit? One, it's a best practice. Agencies do this all over the nation. In general, you should do it about every 3 years just to make sure that you're covering the right people under your plans. It has been about 10 years. We look at it's been about since 2006 since we've done an audit of this nature. So it was time to put this back in place. And it's something we'll do on average about every 3 years moving forward. Now, what's the goal of the audit? As I mentioned, we want to make sure that the individuals that are covered under our plans are eligible to receive benefits. That's important to you and the county, because if we're covering people who are not eligible, that directly impacts what everyone's paying on their rates. So let me put it this way. We have 7,000 employees. If every employee had a dependent on that plan, that's 14,000 individuals covered by healthcare. On average, organizations will find 4% of their benefit population will drop off of coverage after they do an audit. People like an ex-spouse or a dependent child that should have dropped off because of their age but never got dropped off. So 4% of the population drop off, we're no longer paying 4% of individuals' claims. That again, claims and the healthcare utilization, that's how we get our rates. So we need to make sure that we're covering the right people under our plans. Yes, a dependent audit can be a pain. It's a lot of work to go through, but in the end, it's a cost containment measure. We want to make sure that we're covering the right people, which directly impacts how much we're paying for healthcare. Okay? So key point, and I'll talk about what you need to do for the audit, but key point, in order for employees' dependents to continue to receive their benefits under the health plan, you do have to take action by November 11th. So make sure you write that down. November 11th, you're going to have to provide proof of relationship documents for your spouse and your children. And I'm going to talk about what those documents are. So proof of eligibility includes copies for a spouse. You're going to need to have a copy of a marriage certificate. The copies I'm going to talk about, they don't have to be certified copies, okay? Just a regular copy. Now, a marriage certificate, once they give you a marriage certificate, they never take it away if you get divorced. So unfortunately, a marriage certificate alone is not enough to show that you're still legally married. So for a spouse, in addition to a copy of the marriage certificate, you're also going to have to show proof of relationship. Now, I'll tell you what these documents look like, but key point, all confidential information should be redacted from these documents. So take some white out, take a permanent marker. We don't need the social, we don't need bank account numbers, we don't need to know how much money you have in there, but we do need a record showing the name and address. Documents that will work for this could be a tax return document, a joint filing to show the marriage. We don't need all the pages of your tax return. We just need that top page showing the name and address. Again, white out or permanent marker, redact some of those numbers and the other information. A joint bank account record. Again, we absolutely do not need to know your bank account number, dollars amount, or anything else. So you're going to want to get rid of or redact the information on there. Utility bill. If you have a utility bill that you have your spouse's name on and your address, that'll work as well. If you're sitting here thinking, I have none of these that have both of our names on them, then we'll have an alternative. There'll be an affidavit that you can sign, just saying, yes, I'm legally married, and you'll have to get that notarized. Okay, so if you don't have anything, there is an alternative, but you still have to provide that copy of the marriage certificate. So 2 documents for the spouse. Now, for your children, you're going to need to provide a copy of a birth certificate. Again, it doesn't need to be certified, just a regular copy. And adoption paperwork, proof of legal guardianship, those documents, any one of those documents would apply. Now, again, why? Again, it's a cost containment feature. We want to make sure we're getting control on who we're paying for, but it's also to remove people who shouldn't be on the plan. Employees get divorced. Sometimes they forget to remove a spouse from their plan, or even a dependent should have come off. They haven't. It's just time for us to clean up the records and make sure we're covering the right individuals. Key point here, if you have somebody that should drop off your plan, we're not taking any action on anybody that drops off a plan. So we're not coming to you and saying, why did your husband drop off? Why didn't he drop off before? We're just cleaning up the records and getting it right moving forward. So no action will be taken for anyone who drops off a plan as a result of the audit. So let me talk about how you're going to submit these records. Some of you may already have received a letter in the mail this week from the company that's working for us, HMS. Again, HMS is the agency that's doing the audit. If you haven't gotten the letter yet, you should be getting it in the next few days. The letter will outline the process on how to submit this information and where you can submit it. You will have to go to the HMS website. The letter that they give you does have a reference number. You'll log into the website using your reference number, and then it'll come up and show you the dependents that you currently have enrolled on your plan today. You'll have the opportunity to verify if they're supposed to remain on the plan or to remove them from your plan. If you're going to leave them on the plan, you have the ability to upload those documents that I talked about just straight to the website. Once you submit them, you'll get a confirmation that they've been submitted, and then you'll get a confirmation that they've been accepted. Okay, so that's the process there. If you don't have the ability to upload documents, there's some additional ways that you can submit those documents. There's a confidential fax line. Just a reminder, if you need to fax documents, you could always go to your library, an Office Max, a FedEx. They have the ability to fax as well if you have any limitations there. Again, you want to review your dependent information that you have on file. If you're adding new dependents or a new spouse, then HMS will follow up with you later on to get the document you need for them. But when you log in, you can go ahead and verify who you have on today. You can do this process immediately. So as soon as you get your letter, you can go ahead and take care of this dependent verification. You don't have to wait for open enrollment. Again, the deadline to submit the documents is November 11th. And again, there's many different steps you can do. You can upload the document, you can fax them. I wouldn't recommend it because they are confidential documents, but if you needed to, you could also send them by US mail. Failure to respond or provide all required documents will result in the removal of your dependent from the benefit plan. So again, not only do you have to enroll them during open enrollment, but you have to supply the documents as well. So there's 2 pieces, the open enrollment and then the dependent verification. So let me talk about the medical plans. The county will have access to 5 medical plan options for 2017. Our carriers remain the same. Metro Health, SuperMed is the medical mutual plan, and then the United Healthcare plan. Metro Select Premier plan, that's the current Metro Select plan that employees participate in. All of our plans unilaterally have some adjustments in co-pays and deductibles. So you want to make sure you review those sheets out there online, and again, I'll show you where those are located. Now, the change for the Metro Select Premier plan is that employees will have to start paying 3% of the premiums to participate in this plan moving forward. Today, employees pay 0 premiums for this plan. Now, it's still highly discounted. Our other plans are at 10% for employees. So we do understand it's an increase and it's unfavorable. However, it's still a rich plan and it's highly discounted. So the Metro Select Premier plan is the current plan, but employees will start paying 3%. The rates are out there online, works out to about $7 and some change for an employee biweekly. I think it's like $17.55 for a family biweekly. The new plan under Metro Health is the Metro Select High Deductible Plan. It's a high deductible plan. What that means is if you're going to your preventative office visits, your physicals, that plan will cover it at 100%. Any of the other services are going to be out of pocket until you reach your high deductible, and it's a high deductible. It's $2,500 for an employee and it's $5,000 for family. This plan currently replaces our bronze plan. This is not a plan that you'll want to enroll in if you have a lot of medical expenses, if you go to the doctor a lot, if you have children, they have a lot of medical expenses, this plan is not going to be for you. If you do not use the doctor a lot, you just go for your routine physicals, it may be an advantageous plan for you, but again, you'll want to review that information and take a look at it and see if it's something you want to consider. The SuperMed EPO plan, that is the current medical mutual plan. EPO just designates it's a exclusive provider organization, which means that through Medical Mutual, you can either go to a Metro Health facility or a Medical Mutual SuperMed facility. There's no out-of-network coverage for Medical Mutual. Something I learned just reviewing our benefits, I'm not sure if all employees realize under the Medical Mutual plan, you can actually experience some cost savings if you go to a Metro Health facility. So a lot of their services, routine office visits, things like that, there's no co-pays, whereas if you go to a Medical Mutual facility, there are. So you want to review that plan because you do have an option of going to both a Medical Mutual facility or a Metro Health facility under Medical Mutual. United Healthcare plans, again, 2 United Healthcare plans, and again, the rates and co-pays, deductibles, they're all out there online, and I'll show you where you can find those. Again, just as a reminder, employees who do not meet with a benefit educator, you're going to get enrolled into that Metro Health high deductible plan. So let's take a minute and just visit the benefits website. This is the web address for the benefits website. When you go to the benefits website, you'll scroll to the bottom, and this is where you have the opportunity to go ahead and book your appointment online. I'm going to go through what that process looks like. It's very quick. It takes about 1.5 to 2 minutes to enroll in an appointment. You can also call. Of course, our scheduling has been very active, so the call volume has been large. You are able to put your phone number in and they'll call you back. If they do call you back, they won't leave a message. They'll just keep trying to call you back. But again, the online enrollment is very easy and very quick. You go to the Explore Your Benefits tab, and it will take you to the page where you can review all the individual plan information. So if you go to the Medical Insurance tab, this is where you can see the plan overviews, which lists the co-pays, the deductibles. There's a rate sheet here. They should also be adding on here today, there's summary plan descriptions or benefits and coverage descriptions that'll be up here. Right now, you can find those benefit coverage descriptions on the last resources page. So there's a lot of information out here. Take some time, review the information, because there's a lot out here that you can review on your own. This is one of the benefit and coverage areas. It talks a little bit more about each individual plan. It talks about, again, deductibles and information like this. So again, just take some time and go over these documents. And so you're prepared when you meet with that benefit educator and you can have a quick and valuable appointment. So if you do go to schedule online, this is the page that will show up. It's going to ask you for your last name. If you are experiencing any issues, if your name's not showing up, if you're a new employee and you're not showing up in the system, please contact either DirectPath or Human Resources so we can get you some assistance with that. Employees who do have a junior, a senior, or anything like that with their name, you do have to include that in the sign-in. but you'll put your name in, your birth date, it'll show you your address. Employees will have the opportunity to update your address at the benefit educator meeting. We encourage you, please give us good addresses. As we're sending out information, we get a lot of return mail because we don't have updated addresses. So please make sure you update that address or get with your HR representative to update your address too if you know it's not up to date. It'll then populate an area where you can fill in your email address and your phone number. A lot of information will be coming through email. I suggest to employees use your personal email address. We get a lot of emails here, so it's nice to get it to a personal email address where you may not have to sort through all the other information. Also, use an active phone number. If you sign up for an appointment by phone, they're going to call the number that you've put here. So you want to make sure you're giving a good number. Mobile phone number. If you're like me, I need multiple reminders. They'll send you a text message reminder. They'll send you a text message confirmation. They will not sell your phone number. They will not flood you with information. But it is a nice way just to give you a confirmation and a reminder of your appointment. If you only have one phone number, you can put the same phone number in for both areas, home phone number, mobile, or if you don't have either, you can have your office line. But make sure, again, you're putting a valid phone number. It'll show you all the locations that you can choose from. If you do want to schedule by phone, you do have the option of clicking the by phone button and they'll schedule that meeting, and the day that you're going to be having that phone call, they'll call you at the number that you designate. Go through the locations, choose your location. It'll show you all the times available. Again, as I mentioned, they're filling up fast, so make sure you get in there and schedule. They'll send you this email confirmation of where you're going to go. If you did sign up for the text message, you'll get a text message reminder and a confirmation of your appointment. So, what do we need from you? Any employees who are vision or hearing impaired, please contact HR to make sure we can make arrangements for any assistance needed during the open enrollment process. Do take some time to review that benefits website. There's a lot of information out there. And again, we continue to add more information as the days go on. If you do want to schedule your appointment by phone, you can give them a call. They are available actually between the hours of 9 and 6. So you can give them a call. Ensure you have those proof of relationship documents. So if you know right now that you're going to have to submit these documents and you don't have copies readily available, work on getting them. Go ahead and start requesting them now. We know that some of this can take time. Maybe you're going to need more time in getting copies. Call HR, we'll work with you. We understand if you have to get some birth certificates that are out of state, out of country, or even a marriage certificate and you're not going to have it by the 11th, give us a call. We just want to make sure that employees are working on getting those copies. Okay, what questions do you have for me? And I'm going to ask Denise just to bring you the microphone so everybody can hear your question.
If someone is, and I'm asking some of this for other people, if someone is not ready to make their decision at the time of enrollment, do they have to make another appointment or do they have to phone in? That's what the process will be?
Good question. So if you meet with your benefit educator and you decide that you need more time to decide, you will have to schedule another appointment. It's not set up that you can go in and enter it on your own. So you will have to go in and schedule another appointment. Now they won't do another face-to-face, so that follow-up appointment would be by phone. Now, again, even if you enroll and then later on you decide, I want to change my mind, you can just give them a call, set up an appointment, and they'll change you at any time. So again, even if you get to the last minute and it's the 11th and you're like, you know what, I really want Medical Mutual, give them a call and they can handle that over the phone for you.
Okay, 2 more quick questions. For those people that couldn't be here today, will this presentation be available for them to visit?
Yes, we are going to post this presentation. I'll probably send out an email blast to everyone as well so they can view it.
Okay, my last question is, someone had told me that if you have a prescription to get a trainer or a gym membership for health reasons, that if you are in this flexible spending account and have a prescription for this, you would be able to get reimbursement. Is that still going to be in effect for this year?
So the flex spending accounts are still in effect, and there is more information on this website. There's actually a link here. Let me go back here. There's a whole page with flex spending information. So you can see information out here on the deadlines, The dollar amounts, we are looking to update the dollar amounts, the maximums that you can claim. So information will be coming out on that.
When I looked at that, that was not included. So I don't know if,
The dollar amounts.
no, the memberships for gyms.
So if it's you mentioned a prescription.
That's what I was told you needed.
If it's a prescription, any out-of-pocket copays, I do believe would be eligible. I can double check on that, but I do believe if you have a prescription, then that makes it eligible for an FSA, a flex spending account reimbursement.
You mentioned that we're getting a wellness program back.
Yes.
When will we get more information about that?
Our goal is to implement it at the first of the year. So we are in the process now of awarding a contract to a wellness consultant. So we will have a wellness consultant that'll come in and help us build the wellness plan. We do have a new wellness coordinator. She's begun to send information out, and we'll continue to send information out just on things that are up and coming. But our goal is to have it at the first of the year. I say no later than the first quarter, but we really are pushing to have it early on in the year.
So should we keep our Benny cards?
So the Benny card is different. The Benny card was through the Vitality program. You need to use your remaining funds on the Benny card and then get rid of it because it's no longer valid after the end of this year. So make sure you use what's on your Benny card, and then you can destroy your Benny card. But yes, you do only have until the end of this year to use whatever you might have on that card.
This question is along with the wellness program. I was told that we might not have the points that, with the Vitality program, we were able to accumulate points when we belonged to a fitness center or did certain activities. And that was truly a selling point. It was a motivator. Will you guys reconsider, or are you considering something like that that will just give people a little bit of extra push to join, I guess be more health conscious? And personally, I was able to use some of those points for co-pays and
Sure.
stuff. It really helped.
So physical fitness, it will be a big piece of the wellness program. We have not even begun to identify what that will look like, but we fully believe that there needs to be some type of incentive structure in place, whether that's incentives through your healthcare premiums or points, that's yet to be determined. But physical fitness is going to remain a key point and an option in a wellness program. So it's not going to get lost there. There's going to be multiple components of the wellness program, and absolutely physical fitness will be one of them.
I know in the past, last year, the county offered an allowance towards healthcare rates. Is that included in this price, or is the county not contributing anything?
So the benefit allowances still remain depending on what union you're in. There's a different benefit allowance. Now the rates are the rates for everybody. The benefit allowances are going to be calculated separately. So what they did in previous years is the benefit allowance were built into the rates, and we had 20, 30 different benefit charts with all these different rates. We've separated the two out. So when you look online and you see the rate, that's the rate that you're going to experience. And then depending on what benefits you enroll in, or if you waive, you'll get a different benefit allowance. And again, that depends on which union you're in and what benefit allowance you had. But that benefit allowance does remain.
So will we be told about that during our meetings, or?
You won't. I'm actually we're putting together a chart that we'll put out there so that you can know exactly what you'll see in your paycheck. Again, it was a little confusing in previous years. We had so many different benefit charts and rates, so we worked on splitting those out. So we will put out information out there so you know, based on your situation, exactly what benefit allowance you'll see.
Okay, will that be available before Monday when the meetings start?
The goal is to actually have it out there today.
Okay, thank you.
Mm-hmm.
Hello. A little specific on Medical Mutual. We call it an EPO, but when we go to the Medical Mutual site, they have everything but EPO. And I'm wondering what the equivalent is so we can shop for doctors and such.
So EPO just stands for Exclusive Provider Organization, and you're right, Medical Mutual does have different types of plans. Through Medical Mutual, the EPO just means, again, the Exclusive Provider Organization. You can either go to a Metro Health facility or an in-network Medical Mutual SuperMed facility. So our plan does not cover out-of-network expenses, and that's basically what the EPO designates. SuperMed. You'll be looking at the SuperMed plan under Medical Mutual.
She may have answered my question, but I'm not clear.
Okay.
I wanted to know, how do we see the rates? Is that what the young lady was asking back there?
So the rates are out there on the medical insurance tab, and there's a button you click on for the 2017 benefit rates. So that chart gives you the premiums that you're going to pay for each plan, the biweekly premium that's going to be deducted from your pay. These other documents and overviews here will show you your co-pays and deductibles.
Okay, thank you.
Sure.
Good morning.
Morning.
I have both Medical Mutual and the CVS Caremark. I've called them both yesterday to see what the cost expenses are going to be able to try and go online using the rates that are given to choose a plan for my appointment. Neither one of them have said that they've received any of this information from the county, so they can't give me any accurate information in terms of like what a tier 4 prescription is going to cost me with the change from 10% of $1,500 to 20%. It's $750. When will that information be provided?
So we can get some information on the tier 4. I was going to say the other copays are listed, but yes, when you get into the tier 4, you're going to need a little bit more information. So we can make sure we get that and put some more information out there on the website for you. And I'll write down your name too so we can follow up as well.
Okay, when were they going to be provided to the insurance companies so that they can give us what the cost is going to be?
I guess I'm wondering, I'm surprised to hear that they don't have it. So I don't know if that's just a customer service issue or something else, but I'll look into that. We've been working with Medical Mutual and all the plans, so I'm not sure that that's the case, but it just may be an issue through the customer service. So we'll straighten that out.
Okay, thank you.
On the basic insurance, the basic life insurance, in the past, there has not been a charge, and there was a set minimal fee. If we wanted to increase that amount, we could do it for a percentage. Is that still available?
Yes, so that's the voluntary life insurance plan. And under the voluntary life insurance plan, so again, moving forward, that'll be through Trustmark. If you enroll in that plan, previously, there's a requirement that if you make certain elections, you might have to fill out an evidence of insurability. The evidence of insurability moving forward is not going to pertain. So if you enroll in a new plan moving forward, many of you will not have to complete that evidence of insurability. There are some age restrictions that the plan has. So there's information out here on the site. Anyone under age 65, you can enroll in up to $500,000 without an evidence of insurability. 65 to 69, it's up to $20,000, and then age 70 plus, you're going to have that evidence of insurability. But you'll be able to enroll in any level of coverage, and then that'll come out as a payroll deduction from your pay. I'm not sure if I got to. Guardian, correct. If you could give her the microphone just so everybody could hear.
I was asking about the Guardian. You're talking about a different life policy?
So you're asking if you can purchase further Guardian insurance?
Yes, because right now in the old system, which was Guardian, we had eligibility. I think the lowest dollar value was $6,000. I went up to $10,000. So is that $10,000 still available to me, or?
And I'll just ask one of my benefit coordinators to, I'm not sure on that question.
I have that same same question, Debbie, and I've been waiting for an answer for that as well. But I have your name, and I'll make sure and email or call you. Okay.
There's been no changes with the Guardian plan, so if you've done it previously, you would be able to. So we haven't changed anything with that. And again, 6 months, I'm learning all this, but that's one I wasn't aware of, if they could enroll. But there's been no changes. So if you want to increase, you can. But we can follow up with you.
Hello?
So they just indicated through the Guardian plan, you can increase up to $10,000 under that Guardian plan.
So you mentioned that the benefits allowance rates will be available at some point today. Where would we find that?
So I plan on putting it in probably 2 places. One, we'll add it to that medical insurance page, and it'll also be on the resources page. I'll have it in 2 locations just to make sure employees can find it.
Hi, I had the life insurance that said 2 times your salary. Is that still available? Because I don't know if that was under Guardian or not.
So that's your voluntary life insurance. That'll be under Trustmark. So if you currently have it through Unum, that's your option where you can either keep it with Unum or you can transfer to Trustmark. But your voluntary enrollment, you do have options of enrolling in different levels of coverage based on your salary amount.
So what we put in there already is just gonna, if we don't stay with Unum, it'll just be, because was that whole life? Because I don't remember that. That Guardian, that's why I didn't know.
So if you have a Guardian plan, your Guardian plan remains. There's no changes to Guardian. Okay, so if you have a whole life policy through Guardian, that's separate from the one I'm talking about. Your Guardian plans, there's no changes. Any other questions?
Hi, this is concerning the medical mutual plan as well. In the past, if you were on the medical mutual plan, you went out of network, there was some coverage. It just was a lesser coverage, kind of like the United Healthcare plan. Now it's saying not covered because suppose you go to a medical mutual hospital, you need x-rays, turns out the x-ray tech at the medical mutual facility is not a medical mutual provider. Am I going to be responsible for the entire payment for the x-ray tech? Because that's a big change from what I had last year on my medical mutual plan.
Sure. So I'll have to look into that as well. My understanding is this isn't any different. So I know that there are some emergency services under all of our plans. It doesn't matter where you're going. If it's an emergency, the rates and the coverages will apply. But I will have to look into that. I'm just
Because usually in emergency room, sometimes the doctor that comes in, say you go to a supermed hospital, sometimes the doctor that comes in is not a supermed provider.
absolutely.
So you would end up, that's real important in determining which plan I stay on.
Absolutely. The emergency service is under any plan. If it's an emergency, the ambulance is going to take you to whatever hospital and the coverage will apply for emergency services. So the emergency is a little bit different than the other services. But I think to answer that follow-up question, yes, the emergency services, if you have medical mutual and they take you to a UHC, they're going to cover the benefits because it's emergency in nature.
But suppose it's not by ambulance and I get hurt and I drive myself up, but it's still something I need to be at a hospital for, break a leg, whatever.
Sure.
That's where I'm concerned because if that particular doctor is not a medical mutual doctor, I don't want to have to pay his whole bill. The hospital bill will
Sure.
be covered, but I don't want to pay his whole bill.
Sure. Well, if you'll stick around after, I'll get your name. I'm sorry, I just don't know offhand, but I'll be happy to look into that.
Hi, how are you?
I'm good. How are you?
Good. There's an employee who their spouse has always been covered under their insurance through the county, but they're of age to go on Medicare, Medicaid. Do you think the insurance will now push her spouse away and only cover her? because he's eligible for Medicare, Medicaid.
Sure. I don't believe so. And Denise, I don't know if you have some more information on that specific situation.
What I usually recommend is when I get that phone call is that they actually call the provider. So if you have, whether it be United Healthcare, Med Mutual, Metro Health Select, and they'll tell you who's going to be primary and who's going to be secondary. We really haven't had a problem so far. Nobody's returned my phone call to say, Denise, they gave me, bad information yet. Yeah, so I would say call the provider.
If you could get the microphone, they can't hear. It's okay.
Cuyahoga County is not going to push them off, but that person that is of age to receive Medicaid needs to call the Social Security Administration because there may be a penalty involved if they don't participate in such. And then, as Denise said, Social Security and Medicaid and whatever provider they have with the county will coordinate the benefits to see who will be primary or secondary.
Unfortunately, when it gets into the Medicare plans, it truly depends on the type that they're enrolled in and the logistics around that plan. So, although we can give some information, the employees really need to work through through Medicare and others to make sure they understand all the rules and obligations. Yes?
At the conclusion of the enrollment session that we have, are we going to receive a printout of our selections or something emailed to us so that we can
Good question.
file?
Yes, just as in previous years, once you're done with your open enrollment, you'll receive an email confirmation with what you're enrolled in. So again, very similar to previous years with open enrollment, you'll have that email address and you'll get an email confirmation. Suggest to all employees, keep that email confirmation. Too many times employees come back questioning their coverage, and if you don't have that email confirmation to show what you enrolled in, it's very difficult to talk through what you thought you enrolled in versus what you actually did. So yes, email confirmation, make sure you use a valid email address and make sure you keep that confirmation. Great questions. Appreciate the attendance today. If you guys have any additional questions, we'll stick around, and thank you, and hope you have a good open enrollment, and I hope you really get a good experience through the benefit educators. So you guys have a great Friday, and go Indians.